Amyloid neuropathy is a rare and serious condition. It occurs when abnormal protein fibers called amyloids build up in the nerves. These amyloid deposits disrupt the normal function of nerves. This can lead to a variety of symptoms depending on the type of amyloid neuropathy and the nerves affected. Amyloid neuropathy is often a manifestation of a systemic disorder called amyloidosis. This means that the amyloid deposits can affect other organs as well, such as the heart, kidneys, and digestive system. The symptoms of amyloid neuropathy can be quite diverse and often mimic other neurological disorders. This can make diagnosis challenging. Early diagnosis and treatment are crucial to slowing the progression of the disease and managing symptoms. Understanding the different types of amyloid neuropathy, their causes, and available treatments is essential for effective management. This essay aims to provide a comprehensive overview of this complex condition. There are several types of amyloid neuropathy, each characterized by the specific protein that forms the amyloid deposits. The most common types are hereditary transthyretin amyloidosis, or hATTR. This type is caused by mutations in the gene that produces transthyretin, or TTR, a protein made in the liver. The faulty TTR protein misfolds and forms amyloid deposits that primarily affect the nerves, heart, and other organs. Light chain, or AL amyloidosis. AL amyloidosis occurs when abnormal plasma cells in the bone marrow produce light chain proteins that misfold and form amyloid deposits. These deposits can affect various organs, including the nerves, heart, kidneys, and liver. Wild-type transthyretin amyloidosis, or wtATTR. This type is caused by the buildup of normal TTR protein, which can occur with aging. wtATTR amyloidosis primarily affects the heart, but can also involve the nerves. Each type of amyloid neuropathy has its own specific characteristics, prognosis, and treatment approaches. Understanding these differences is crucial for providing personalized care and improving patient outcomes. The symptoms of amyloid neuropathy can vary widely depending on the type of amyloid protein involved and the nerves affected. However, some common symptoms include sensory disturbances. Numbness, tingling, or pain in the hands and feet are often early symptoms. This can progress to a loss of sensation. Motor weakness. Muscle weakness, especially in the feet and ankles, can lead to difficulty walking and balance problems. Autonomic dysfunction. Damage to the autonomic nerves, which control involuntary bodily functions, can cause a range of symptoms. These include dizziness, lightheadedness, digestive problems, urinary incontinence, and erectile dysfunction. It's important to note that these symptoms can also be indicative of other conditions. Therefore, a comprehensive medical evaluation is essential to rule out other possible diagnoses and confirm the presence of amyloid neuropathy. Diagnosing amyloid neuropathy typically involves a multi-step process that includes a thorough medical history, physical examination, and specialized tests. Clinical evaluation. The doctor will ask about the patient's symptoms, medical history, and family history of neurological disorders. Nerve conduction studies and electromyography, or EMG. These tests measure the electrical activity of nerves and muscles, helping to assess nerve damage. Biopsy. A small sample of tissue, usually from the nerves, fat, or other affected organs, is examined under a microscope to look for amyloid deposits. Blood and urine tests. These tests can detect abnormal proteins such as light chains or transthyretin, which can indicate amyloidosis. Genetic testing. Genetic testing can identify mutations in the TTR gene, confirming a diagnosis of hATTR amyloidosis. Imaging studies. Imaging tests such as echocardiograms, electrocardiograms, or magnetic resonance imaging or MRI can help assess the extent of organ involvement. Early and accurate diagnosis is crucial for initiating appropriate treatment and improving patient outcomes. Section 5. Treatment approaches for hATTR amyloidosis. The treatment for hATTR amyloidosis focuses on stabilizing the mutant TTR protein, preventing further amyloid formation and managing symptoms. This medication stabilizes the TTR protein, preventing it from misfolding and forming amyloid deposits. These medications use RNA interference technology to block the production of TTR protein in the liver, reducing amyloid formation. In some cases, liver transplantation may be considered to replace the faulty liver with a healthy one that produces normal TTR protein. In addition to these disease-modifying therapies, supportive care is essential for managing symptoms. This may include pain management, physical therapy, and medications to address autonomic dysfunction. Section 6. Treatment options for AL amyloidosis. Treatment for AL amyloidosis aims to suppress the production of abnormal light chain proteins and manage organ damage. Chemotherapy drugs are used to kill the abnormal plasma cells in the bone marrow that produce the light chains. In some cases, high-dose chemotherapy followed by stem cell transplantation may be an option. This procedure aims to replace the bone marrow with healthy cells that don't produce the abnormal light chains. Managing symptoms is crucial and may include medications to control pain, regulate heart rhythm, or support kidney function. Treatment for AL amyloidosis can be complex and challenging. Close monitoring and individualized care are essential for optimizing outcomes. Section 7. Addressing wtATTR amyloidosis. Treatment for wtATTR amyloidosis has historically focused on managing symptoms, but new therapies are emerging. While initially approved for hATTR, Tafamidis has also shown promise in stabilizing TTR protein in wtATTR and slowing disease progression. Managing symptoms remains a cornerstone of treatment and may include medications to control heart failure, arrhythmias, or neuropathy. Research into new therapies for wtATTR is ongoing, offering hope for more effective treatment options in the future. Section 8. Emerging therapies and research. The field of amyloid neuropathy research is rapidly evolving and promising new therapies are on the horizon. CRISPR technology holds the potential to correct the faulty TTR gene, offering a permanent solution for hATTR amyloidosis. Researchers are developing new RNA interference and antisense oligonucleotide therapies that target TTR production with greater precision and fewer side effects. These emerging therapies offer hope for more effective and targeted treatments for all types of amyloid neuropathy. Section 9. The importance of early detection. Early detection of amyloid neuropathy is crucial for several reasons. Early treatment can slow the progression of the disease, preserving nerve function and quality of life. Early intervention can help prevent or delay life-threatening complications such as heart failure or kidney failure. Patients diagnosed and treated early tend to have better long-term outcomes. If you experience any of the symptoms of amyloid neuropathy, it is essential to seek medical attention promptly. Section 10. Living with amyloid neuropathy. Living with amyloid neuropathy can be challenging, but there are ways to manage the condition and maintain a good quality of life. Adhering to your doctor's recommendations for medications and therapies is crucial for managing symptoms and slowing disease progression. Eating a healthy diet, engaging in regular exercise as tolerated, and getting enough sleep can help support overall health and well-being. Connecting with others who understand the challenges of living with amyloid neuropathy can provide emotional support and practical advice. Remember that you are not alone. With the right care and support, you can live a fulfilling life despite the challenges of amyloid neuropathy. Section 11. Seeking knowledge and support. Amyloid neuropathy is a complex and rare disease, but knowledge is power. By staying informed about the condition, its treatments, and ongoing research, you can play an active role in your healthcare. Look for information from trusted medical organizations such as the Amyloidosis Foundation or the National Institutes of Health. Don't hesitate to ask your doctor questions and discuss any concerns you may have. Connect with patient advocacy groups that can provide valuable information, support, and resources for navigating the challenges of living with amyloid neuropathy. Remember, early detection and treatment are key. If you experience any unusual symptoms, don't delay seeking medical advice.